Hey, what's up, guys? This is the CliffAlias Podcast. I figured I'd do something a little different, show you a little bit of side of what bipolar is like. My friend Okello and I are going to talk about what it's like to be bipolar, some warning signs as to what to look for if you're looking to get diagnosed bipolar, or maybe a friend or family member is going through something wacky and you need to kind of give them some support and you have some basis to go off of. So it's an alternative interview, AI interview to an alternative interview. So it's going to be something different than what the channel is normally, but I think it's important that we go over this part as well.
Yeah, this is going to be fun. We've definitely got a lot of things to talk about. Just to start, I wanted you to take us through kind of how you've been since the last time I've seen you. It's been 3 years. So
Yeah, it's been 3 years. So I was actually doing really well for 3 years. No mania, nothing. And I was doing so well that I thought that I could maybe switch up one of my medications. So I worked with my psychiatrist, and we decided that we would get off the quetiapine. Quetiapine is also known as Seroquel, and it's an antipsychotic medication that has mood stabilizing properties to it, as well as sleep properties and antipsychotic properties. So when I say antipsychotic, that's usually the medication that they use categorically when you're trying to ward off mania. So having that in your system 24/7 gives you a better baseline of kind of like not reaching mania at all. So I was healthy for 3 years. We decided to slowly taper off of the quetiapine / Seroquel, same thing, and switch to a new medication called asinapine. Asinapine is a antipsychotic as well. So essentially I tapered off slowly from that, and then at the same time increased the asinapine. It backfired horribly. I ended up having a manic episode on the 20th of December, 2024. So it ended my 3-year streak of being healthy with no mania. Unfortunately, I was in the hospital for 11 days, but I tied my record for getting out in 11 days because that's how long I was in the last time 3 years ago. This one was a little more impressive, though, I would say, because this was my worst manic episode by far. I won't go into too many details, but it was particularly challenging. And I think for the amount that I've bounced back into the way that I am now, a month later, is pretty remarkable, and I'm very thankful for that.
it's definitely a struggle. And how would you, if you could walk us through that, how did it start? That episode?
Yeah, so I'll kind of go a little bit through how the DSM-5, which is the psychology textbook that kind of goes through all the different mental illnesses and how they're categorically, how they present themselves, how psychiatrists use those definitions to make a diagnosis or come to the conclusions that they are. So the acronym specifically for mania, bipolar type 1, it can be for type 2. I'll touch briefly on what type 1 is first. So there's two types of bipolar. Type 1 is the one where you're more clinically proven to go high and get like the high mania, like kind of like you're on drugs kind of high. And then type 2, which is Okello, is the more low depressive side of things. And it's actually more difficult to diagnose bipolar type 2 because it can usually just be seen as just depression. So getting an actual type 2 diagnosis, which you can probably talk about, was pretty tough.
Yeah. I went a long time without being diagnosed and just kind of wondering, why I was always unstable with my mood and, just facing kind of lots of highs and lows where, one day I'm feeling great and feeling like, just really motivated and really looking forward to work and seeing my friends. And then the complete opposite, following up shortly after. So it's mainly things like that. I have also found it like really difficult to keep jobs. I think I tend to, with my highs and lows, employers obviously don't like that.
No.
So usually when I'm kind of starting to get to those bad places in my depression, I'm calling in a lot. I'm getting people to cover my shift a lot. I might miss a week or two. I've taken a whole month off before.
You gotta do what you gotta do to remain healthy, right?
Yeah.
And it's great to have an employer that understands but it's tough to find that employer, especially when it's like I'm off on work right now, and I was very fortunate that my company kept me on because I hadn't passed probation yet. And so what they did to kind of mitigate their risk was just put me on another 90-day probation when I do return on February 10th of this year. So we kind of got a little bit distracted as to how my manic episode presented itself. So we'll just get back to like the dig fast. So D stands for distractibility. I'll give you an example. So I was playing some board games with my friends, but I just couldn't sit still. I had to get up and continue making the soup that we had started earlier that day, and just like kind of flip flop between playing the board game, doing soup, and just getting very distracted. And yeah, that kind of leads to the next point of like I, which is impulsivity or indiscretion. So it's just like, okay, okay, I don't know what to do, or at the same time, it's just like whatever it comes to your mind in that particular moment is what you're going to do next. So you're very impulsive with your choices and that. So thankfully, this round, I didn't get a level of grandiosity. So that's the G in dig fast. So grandiosity is when you have an inflated self-esteem. I didn't really think I was anybody other than who I was. I didn't think that I could be the next Drake rapper like I did in my first Manic episode. I think we talked about that the last time we were together. But no grandiosity this time. But usually the grandiosity comes when you're having psychosis as well. So psychosis is a whole other thing. It can present itself in all kinds of different mental health. So it can come in when if you're schizophrenic, or if you're, bipolar type 1 or 2, or maybe you just have borderline personality disorder. Those things, that grandiosity can present itself in that way. Have you ever had grandiosity?
I have. I think I have it quite a bit, actually.
Oh, really?
So, it's the good thing about, how long, now that I've been diagnosed, I've kind of, looked into that kind of stuff a little bit more. And so I know when I'm, kind of inflating myself.
Flying high?
Yeah.
Okay. So the next one is F. It's called flight of ideas, also known as racing thoughts. So how my psychiatrists and psychologists kind of define racing thoughts is when you're having thoughts one after another, and they just keep coming and coming and coming. And a lot of your thoughts aren't cyclical. And by that, I mean, so for example, if I was just having a lot of thoughts at nighttime, and just like a regular old person, like I might think, oh, I got to take out the garbage tomorrow morning. And then, 10 or 15 thoughts down the road after that, I'm like, oh, I got to take out the garbage tomorrow morning. So it's like revisiting things that you've already had in your brain before, whereas racing thoughts is kind of like, it could maybe even be in factor with the grandiosity. Like, oh, I can, I'm going to be the next Drake. And then once I'm the next Drake, I can be the next president. And like, it's like things like that. And it's just like, they just don't stop. And the difference of speed as to how manic you are can make a difference. Not make a difference, but like you can tell how manic somebody is if they explain to you how fast their thoughts are.
Interesting.
Yeah, so if they're like
really interesting,
like, because it kind of also it goes with the T part of dig fast as well, as terms of the talkative or pressured speech. So what can happen is somebody who's having a manic episode and they're having grandiose thoughts or flight of ideas, they can think they're just trying to get whatever's in their head out of their mouth. So it's sometimes, if you're really ill, like sometimes it can get as bad as you don't necessarily aren't even making sense anymore. So it can get that bad as well. And then the A for dig fast is increased goal direction or activity / agitation. So these kind of all compile together and they compound on one another. So like when I was mentioning with my friend Bryce when we were playing board games, I was making soup at the same time and I was playing a board game, and just like I was really agitated, and like it felt like the next thing somebody said would set me off, or not set you off in like where you have a rampage or anything like that. It just might set you on like a different path than you were currently had in your brain, and you're what you're presenting as well.
Right. Yeah. Talk to us about like how important it is to have a support system, and I know a lot of people are maybe a little bit scared to even come out and start talking about this kind of thing. So I guess who was the first people that kind of got to know this side of you?
Yeah, so I mean, I was diagnosed in 2011. I had a really bad manic episode when I was in high school. I was 17, and like I mentioned, I just thought I could be the next Drake with like rapping and things like that. And it's really important to have that support system around you, because even if you were to take yourself to the hospital, which I've done quite a few times, it makes sense to bring a family member or a close person with you who kind of can speak to your baseline,
Right.
And be like, okay, normally this is how they act, like usually they're actually like pretty motivated, pretty happy, so that's on track. But the fact that they're talking a mile a minute is not.
Right.
Or maybe it could be the person who's just making observations as well that you wouldn't normally make for yourself if you're manic, because it's hard to remember some of the times all the things that are going on. So you might be aware as a manic person that your sleep has been decreasing, but if you've been having like constant communication with, say, your mom, like I do, then like things that I tell her that I would have forgot otherwise, she can remember. So it'd be like, okay, for the last week you had 8 hours of sleep, and you had 6 hours of sleep, and you had 3 hours of sleep, and you had 2 hours of sleep. So having that support group is really important to just be there for you and notice kind of your warning signs and like help you get on back on track. Because when you're hypomanic, it's not too late. People can hit, even regular people can hit hypomania. But if you're in hypomania for too long, that's when it transfers into a full manic episode. But with proper rest and proper people around you noticing your warning signs, kind of get you to like settle down. Maybe you take a couple of days off work and just sleep those days instead. And have that, like having a support system can make a huge difference. And I'm lucky that I have friends and family, and even, we'll talk about it too, there's an organization for Bipolar Affective Disorder group that meets in Calgary and Edmonton as well, and they have online sessions as well as in-person sessions. I should go to it more often. I haven't been to it that often, but I did go to it last week. So I mean, with the way that I've been speaking, it is talkativeness for sure, but this is a healthy talkativeness. Like we're like having a healthy conversation discussion. So, but if I was speaking even faster than I am right now, or it's kind of contradicting as to what I said before. Is like when you're having flight of ideas, your thoughts don't overlap, but when you're manic, you can kind of forget what you've already said,
right,
and not know that you had already said it, 5 minutes before.
So there's a little bit of memory loss associated to that.
Yeah.
Okay. Yeah. Now I know with some of your episodes, it's usually around the holiday season. Is there typically a triggering something specific?
I didn't really realize it before, but the holidays are particularly struggling for me, not because like I've had family members who passed away around this time, and it's a really difficult time for not having your grandma, your father, or your mom, or your sister, your brother, whatever, not there with you in these special moments. For me, it's what Christmas time means to me is more so I don't want to say impending doom of the next year, but it's like you want to make sure your life in the next year coming up is going to be as best as possible. So then I try to make all kinds of changes in December, while trying to anticipate what my life is going to be like for the upcoming year starting in January.
Right.
So it's kind of funny. This manic episode that I had on December 20th, 2024 is exactly 14 years to the day that I had my last manic episode. My first manic episode.
Yeah.
So it's kind of, anniversaries are actually somewhat important, it seems. That I wasn't actually really cognizant of. Like I knew that I was struggled during the holidays, but I just didn't know to what degree, and now it makes more sense to me.
Yeah.
That I didn't have that perspective before.
I want to ask, is there anyone else in your family that deals with mental health issues?
So my aunt has been suspected to have some sort of mental illness, but as boomers are, like they just dealt with it, right? Like they didn't get a diagnosis of any kind. They just know how to deal with it in their own way, and they get through it, right? But I'm the first person in my family that's clinically diagnosed bipolar. Nobody else in my family has it. But something my mom always reminds me of, I never really struggled with anxiety before my my fourth manic episode.
Right.
It was after that really changed things for me, and part of that was smoking weed.
Yeah.
That kind of triggered a bad panic attack, and once you have one bad panic attack, you're always worried that they're going to come back. So doing drugs and smoking weed, I've never done any other drug besides smoking weed or drinking alcohol, but substance abuse is very troubling too. But yeah, I don't, nobody else in my family is diagnosed.
Yeah.
Actually, that's not true. Sorry. My sister has ADHD and depression, and my other sister is borderline personality disorder, but nobody is specifically bipolar, just me. I forgot that.
Actually, when it came to the DigFast definitions there, I think it was the T that I wonder if that's related to ADHD.
The talkativeness?
Yeah.
Yeah, so I'm glad you brought that up, because for years and years and years when I was growing up, my family and my my teachers were like, oh, like, we suspect you have ADHD. But the thing is that, like, when it came down to it, I never had troubles focusing. It was just the hyperactivity, which can overlap with bipolar. So like when I had this, impulsivity or indiscretion, it's like blurting out in class, trying to be the funny class clown, and then getting kicked out of class, but then still being able to do well in school because, when the time that I was in class, I paid attention and I did my homework.
Yeah.
And I didn't have any focus issues in terms of when it came down to staying on task. I could, as long as I wasn't ill.
Right.
And when my baseline was that I could focus, and that that's where other people with ADHD is actually different. So they have a lot of overlaps, but and you can actually be bipolar and ADHD, but I'm pretty sure I'm just bipolar. Because I think if I were to take stimulants, which is the typical route for ADHD medication, it would just send me to the moon.
Yeah.
So,
like Vyvanse or something like that.
Yeah.
Now, you said when you were 17, this is kind of when it all started. Did you ever experience? I know everyone experiences depression to a degree, but leading up to the seriousness of your mental health, did you ever suspect that it might be a little more serious and depression?
No, I think that I don't know. When I look back at it, it would make sense now because I hate kind of following the trope that bipolar is okay. You're happy one minute and you're sad the next. It's, for the most part, it's not generally like that. Like when you're experiencing mania, you have the opportunity to experience either end of the spectrum. And when you're in mania, that's when you can cycle through highs and lows. But it also depends on the type of person you are too. Like, I'm not really a person who gets depressed. So when I go manic, I just stay on the high end.
Right.
And I kind of cycle in and out of being being really agitated and wanting my meds, for example, now rather than having to wait. That's one thing. But when I was younger, I just remember also being like I would just bottle up my emotions, and eventually somebody would say something that broke the camel's back, and then I would cry for an evening, and then the next day I'd be fine. Yeah. So that is, I don't know. I think that's probably is pretty categorically bipolar.
I think
you cry one night, and the next day you're fine. So
I've been there. I have been there. As far as impulses go, are there specific things that you struggle with when it comes to that category?
Impulsivity.
Yeah.
Not in my day-to-day life, no. Sometimes I actually make it harder on myself to make decisions.
I see.
So it does touch on the impulsivity, but maybe it's the fact that I know that I can be impulsive. So when it comes down to making certain choices, I freeze,
right,
and try to overanalyze going into which choice I should make.
Right.
But whereas when I'm manic, I would just, make a choice and deal with it. I wouldn't stew on it for very long.
Yeah.
Yeah.
Just trying to think about the organization OBAD.
Yeah.
Maybe touch a little bit on that.
Yeah. So OBAD stands for Organizational for Bipolar Affective Disorder. So that's what technically bipolar people have. When we say we're bipolar, it's a bipolar affective disorder. That's when somebody has borderline personality disorder. BPD is a categorical name for borderline personality disorder and not bipolar disorder.
I see.
Yeah, so that's why it's bipolar affective disorder, and then there's type 1, there's type 2.
Yeah.
And then they're doing some more research. I think there's going to be a third one maybe come out if they do a DSM-6. And it's somewhere who like rapid cycling maybe. I'm not sure. I don't know much about the other outside potentially how type 1 and type 2 present themselves.
Right. What's it like for you slipping into like mania?
Yeah. So I'm very self-aware, and I know when I'm going manic. The sad thing for me is that usually if I'm going manic, and I realize it's already too late. I need to be better at recognizing my warning signs a lot sooner.
Right.
Because I've had hypomania where I've just, taken extra medication, went to sleep and essentially took the next day off and just slept for, the 12, 14 hours that my medication allowed me to sleep and basically sleep off the hypomania.
Yeah.
But if I am hypomanic too many days in a row, it could slip into full manic episode pretty quickly for me. So that's why it's kind of a double-edged sword with the quetiapine, because it allows me to sleep for a long time.
Right.
But like you mentioned, it's kind of like, I'm 2 hours late for work one day by accident because, I was hypomanic the night before and I had to take extra medication. I didn't fall asleep till 2 a.m. And then now I need to sleep more than 8 hours, and I need to sleep 10 hours. So then I sleep from 2 a.m. to 12 p.m. And then here it is.
Yeah.
Usually I've been a lot better at going to work, but I'm not sleeping in that much. But those days that, like, for example, with this manic episode that I had, there was one day where so I'm normally on 600 milligrams of quetiapine.
Right.
But while I've been healing, I've been on 800, but I'll just go back to the 800 before.
Yeah.
I guess we could also kind of touch on how many milligrams I guess we're on of each of our medications too. We haven't done that yet.
Yeah.
So I'm on 1,200 milligrams of lithium, 200 milligrams of lamotrigine. So lithium is a categorical bipolar type 1 mania medication. Lamotrigine is a bipolar medication as well. It's a mood stabler as well as lithium is. And it's more so for the lower end to prevent you from going low. And then I'm on quetiapine, which is an antipsychotic. I'm on 200 milligrams of lamotrigine, and then I'm on now 800 milligrams of quetiapine. That's an antipsychotic that helps me sleep and regulates my mania. And then I'm also on an injection called Invega Trinza, also known as paliperidone. The Trinza is just a 3-month dosage where they inject you with, in case is 350 milligrams of the substance. And then that way you have something in your body 24/7. And if you miss your medication, which I don't, I've never missed my medication in the last 14 years. That's something I'm pretty proud of.
Very impressive.
Yeah, like I've never purposely missed it once. And the only time I've ever missed it was when I was heavy drinking and I would, forget to take it on a night out or something like that.
Yeah, that makes sense.
But I kind of realized that this manic episode, and I was like, that is a very impressive statistic.
Yeah.
So, we were talking about the medication and where we were going after that.
I was just going to ask you, like, I know, like, we can feel a little insane. Like, I was wondering if you could explain what
Oh, yes. Explain.
one other definition of what insanity might mean too.
Okay. Yeah, so I joked about the last time when we met 3 years ago that there's a comedian out there who when somebody tells him the definition of insanity, he pretends like he doesn't understand and gets them to repeat it. So they'll be like, the definition of insanity is when you try to do the same thing more than once and expect a different result. It's like, oh, really? Could you please explain that to me again? I don't understand.
Yeah.
But I don't know. I can feel myself slipping away, and as long as if I just do my strategies of upping my what's called PRN medication is like take as needed. So when I'm having issues with my sleep, I can take an extra 200 milligrams of quetiapine to kind of knock me back into my senses and ward off the mania and get proper sleep. But if I have too many days of that in a row, then it can slip into full mania pretty quickly. And then once I'm in full mania, there's no turning back. And it can be different levels of how intense it is. Like I mentioned, this previous manic episode was very intense, but my two before that were less intense. And the intensity is just like essentially how silly you can get in terms of like the things that you do while you're in there. So like they might need to keep you in high observation for a lot longer than a mild one where you could just be out with a regular group of people instead. Whereas if you're in high observation for the majority of your stay in the psych ward, then that you can kind of categorize that as a more intense, because they need to monitor your medication a little bit more closely, your behavior a little more closely, and kind of keep you in check that you don't hurt yourself or others as well.
I know. So our buddy Josh, when he's in psychosis, he can hallucinate. Is that something you experience also?
No, I've never hallucinated. I've had psychosis, like I said, where I thought that I was somebody that I wasn't. Right. I've never heard or see things that aren't actually there.
Right.
Yeah. So I know Josh has been working with his doctors trying to figure out, is he just bipolar? Is he schizoaffective? But that's something for him to figure out. I wouldn't know how to.
Yeah, and we'll have him on another time.
Yeah.
When you say you think you're someone else, is that like?
It's not. Yeah, like it's more so like who the person you think you can become someone else rather than
I see
fully adopting like I am Batman or something like that. Right. So
I do actually understand that. I feel like when I'm feeling grandiose, I definitely, when I am inflating myself, I look at the people who I think I could potentially become, and I start to pick up on little things that it is kind of like molding into someone that you're not a little bit.
Yeah, so I think it's kind of funny is my first manic episode, I thought I was the next Jesus.
Interesting.
For a very short amount of time. Thankfully, I snapped out of it pretty quickly.
Yeah.
But there was probably at least 15 minutes where I was like, yep, I'm the next Jesus.
That is so interesting.
Yeah, and then my third manic episode, my buddy Rob Mercer, he was helping take care of me, like really important about that support group as well. And he reminded me this year that this particular manic episode, my third one, I didn't think I could be the next Jesus, but I said to him, I think verbatim, I'm not the next Jesus, but I hope to be almost as influential as he was, which is crazy because Christians are like 1.2 billion people in the entire world. So that's insane.
That is very wow.
Yeah.
For support, like my support system is kind of like my girlfriend, my parents, like I've talked about kind of how I miss out at work a little bit sometimes. I'm at a job now where they understand me pretty well.
Good.
And my struggle. Another thing that I use for my support system is I call the helpline a lot.
Yeah.
So I've called them
811 or
sorry,
811.
811. Yeah.
Yeah. I called.
So I was gonna ask you call. Yeah.
Yeah. Like that's what I didn't do it this manic episode because I I've had 6, so I kind of know the ins and outs. But I dialed 911 when I was in this apartment, and I had been consecutive days of less and less and less sleep and more mania. And I had gone to sleep at 11 p.m. and I woke up at 3 a.m. and I was just like incredibly manic, so manic that I woke up my roommate Bryce and I was just like, hey, like this is a manic episode. I'm calling 911. I'm going to the hospital.
Yeah.
So I have the self-awareness to be like, okay, at what point do I call 911? But I remember in my 3rd and 4th manic episode, I called 811. I was like, I'm having mania. I don't know if this is full bipolar. Like, can you kind of walk me through some things? And
Right.
and they did. So that was really helpful. Yeah, I've even called 811, and then they directed me to be like, you need to call 911. So that was my 4th manic episode, I think, or maybe my 3rd one. No, 4th. No, second. Second manic episode. I was talking to 811, and they recommended that I hang up and dial 911. So that's what
I did. This summer was actually the first time I actually ever went to a hospital. And what that kind of looked like was I was arranging my uncle's funeral, and there was a lot of like phone calls and text of kind of like what was happening next. And I faced a lot of difficulty there. And
Sorry to hear that.
Yeah, it was definitely a hard time for me. I didn't think that, like, I wasn't that close to him, but it just kind of brought up some old memories of my childhood. And for some reason, I'm not exactly sure still what triggered it so much, but I'm just like laying in bed one of the mornings, and it's kind of like, you're way too emotional, and you call the helpline, and you're just trying to calm down a little bit, but you can't. So something that I deal with is suicide ideation. So
yeah, I get that too.
It's really hard for me to know if it's that or actual suicidal like thoughts sometimes. So this particular morning, it was kind of just like, okay, the helpline didn't help really. Well, it did, but I kind of just got back into the same bad mood that I was in, and so then I decided to call 911, and that was after I kind of started writing suicide notes to everybody, and so that's the worst it's ever been for me, and so that was a new low for me this summer, and
thanks for sharing.
Yeah, and I definitely experienced for the first time ever like memory loss. I was missing a lot of appointments, and they'd call me and be like, "Yeah, you had an appointment today." I'm like, completely forgot, and that's never happened. I'm like very punctual, very aware of appointments. So the helpline is so great.
Well, there's actually a new helpline out there too that's specifically mental health. Now it's 988 is the new. It's specifically for mental health awareness countrywide. So there's 911, obviously for emergencies. There's 811 for like cold and flu and all that, and then now there's 988 for anything mental health related. So I remember that.
I love that. Yeah, I'm so glad. That's been around for a couple of years now.
I just heard of it this year.
Oh, you did?
Yeah, but I'm sure it has been. Yeah.
Yeah, I think I remember when it first came out, and I was pretty happy. But anytime there's more awareness about mental health, I'm happy about it.
Yeah, I'm happy you actually, well, in a sad way, but you brought up something that I would have forgotten to talk about if you didn't bring it up. But when I get manic, I get suicidal ideations for sure. But I've never wanted to kill myself ever, and I'm actually very afraid of death. So my suicidal ideations are more so for people to take me seriously. When I say that I'm, this is a manic episode, please help, right? So, for example, like my mom has used this example numerous times in talking to me since I've been out of the hospital. But, like, for example, I went in at 3 a.m. and I didn't get to the Peter Lougheed, and then I went through all the triage system, and I actually didn't get a bed until 8 p.m. that same day, which is, I don't know how many hours, 12, 15, no, 18 hours.
Yeah,
or something like that. And then when I did get to the unit that I was supposed to sleep in, it took an additional 2 hours on past 8 p.m., which is when I normally take my medication,
wow.
for them to give me the medication that they needed to
Wow.
give me. But part of what accelerated that is
It's almost a full day.
So I literally I had done it many times that day as well for people to accelerate the process, because I know how to manipulate the system, which sounds sad to say, but when you're that ill, sometimes it's your only means of communication. But where I'm going with this is one of the examples my mom uses is I was in the unit 27 at the Peter Lougheed, and they hadn't given me my medication yet, and I literally went up like, I'm not violent, but I can definitely be not, I don't know, just like animated.
Yeah.
Yeah, so like I went up to the table, I was like, my name's Michael John Clifford, I'm bipolar type 1, I'm in a manic episode, get me my medication, I'm suicidal, I will kill myself in like 10 minutes if you don't do what I ask.
Yeah.
Which is so ludicrous.
It's crazy, but unless you really like vehemently demand something, you're gonna wait a long time, and like the wait times are crazy. And so like,
Yeah, so
I'm glad you know how to manipulate the system.
well, that I did that,
your favor.
like that's why it's good to have a family member with you, because like, okay, like he's very ill,
I see.
but he's not like actually going to kill himself.
Right.
So
Yeah.
that's why, because I had a friend with me first, and my mom with me, and my dad with me, and that was good, because I did end up repeating myself a whole bunch of times as well. But that was good to just have a support, somebody there to be like, okay, these are the medications he normally takes, this is how he normally acts, things like that. So, but I don't know, like even being there for that long and threatening my life multiple times, it still took 18, 20 hours, like before I was able to. They did give me, I think they gave me 1 dose of Ativan, which is a categorical benzodiazepine, which is used for anxiety usually, or just like any form of distress. The Ativan will literally take the edge off.
Right.
So they gave me some of that in the middle of the day, but other than that, I didn't have any other additional medication for when I really should have been probably administered some quetiapine or some quetiapine a lot earlier, and just, but sometimes they need to, as Josh has said before, he said to us, they need to see how bad you're going to get so that they know how, like, what to treat you with. Because if they give me 200 milligrams of quetiapine in the middle of the day, that might last for 6-7 hours, and I'm relatively calm at this point now, instead, rather than being fully manic instead. So that's why they try not to give you more meds than they need to.
Right. Having been, dealing with this kind of thing for a long time now, have you learned anything about yourself that you maybe
Don't
were
like?
a little surprised about, don't like?
Oh,
do you like being manic?
Yeah, so I know when last time we talked 3 years ago that I kind of touched on liking hypomania.
Yeah.
And I've definitely come to the conclusion that I like hypomania. It's funny,
what about it do you like exactly?
Like, you're more motivated to do things, you have more energy to do things.
Yeah.
For example, like in the week that I was hypomanic, amping up, like I got a physical booked, a eye doctor booked, and a dental doctor booked, all for the same day within the same week. And I went to all of them, got them all done, and
busy
just like
schedule.
yeah. So yeah, it's just like I like the fact that I can, because if I'm taking too much quetiapine, it's hard to get up the next day. I still do manage to get up, but like I'm pretty groggy at work for 2-3 hours.
Yeah.
I don't get much done, or I sleep in by accident also, and now I'm an hour late to work,
right,
which doesn't look good. But something that I found that I don't like, I won't go into too much details about it because it is pretty personal, but it's definitely goes into the realm of intrusive thoughts. So for example, this
Yeah.
isn't me particularly, but an example of intrusive thought that like anybody could have would be like, for example, if they pick up a knife and then they're just like have an intrusive thought, be like, oh, what if I killed somebody with this?
Right.
Or something like that. Like
Yeah,
anybody can
exactly.
have that kind of thought. It's just an intrusive thought that you just say to yourself, oh, that's a silly thought. Like I would never do that. It's not kind of, I don't want to do that.
Right.
To whoever thought I would, I might do it too. Or like, it's not who I am as a person, and it's an intrusive thought. Label it as that and move on.
Yeah.
And a lot of everyone has intrusive thoughts, and you kind of just need to work through it in your own way. And I have done that. And going to Vietnam in the summertime this year for 2.5 months.
Good amount of time.
Yeah, it wasn't as life changing when I was there for me to realize, but it was life changing when I came back, and I was really able to deal with my intrusive thoughts a lot easier. And I basically before going to Vietnam, I was in therapy for like 3 years of off and on, usually once every month.
Yeah.
But I had some traumatic experiences. My psychologist committed suicide, so I had to wait until I got a new psychologist, and then that's like
unheard of.
Yeah, and then
wow.
And then my therapist that I got in place, they switched to their own practice. Then I had to wait another few months before I could get back in the system, and then once I was in the system again, I got a really good therapist. Her name was Kate, and we worked on some really great stuff. But then she said to me before I went to Vietnam, she's like, "You've been in therapy for a while, like." And you're aging out of the system. And essentially, when like through the Foothills Mood Disorder program, I was put into like not a triage program, but like they only offer you so many sessions before you age out of the program. Okay. And I had hit the max number of sessions.
Gotcha.
Right before I went to Vietnam, and then I haven't been back to therapy since. But my life's been pretty good, minus this manic episode.
Yeah.
So yeah.
With like some of your employers, are they usually pretty understanding?
If I communicate well enough. I mean,
is that something you're even interested in sharing with them?
Yeah. So the company I work for now, like knows I'm bipolar. I mean, I've told all of my jobs that I have, but I think this particular job that I have now with Synergy is especially great because my boss has a son who's bipolar. So
gotcha.
You know,
they can sympathize with that.
Yeah, and they're great. Like if I don't want to start till 9, or if I want to take a longer lunch so that I can maybe work out on my lunch instead, and then have an hour and a half lunch, and I just work half an hour later.
Yeah,
they're really understandable about that. So yeah, I really like the company I'm working for now. It's great, especially because they could have said sayonara to me because I hadn't passed my probation. But
that's right.
I have a lot of ideas about what I want to do for that company, and I think it's going to be a good fit.
That's good to hear. I think most. Well, actually, I want to ask: like, do you tell them that kind of thing during the interview, or you? Like...
No, I don't tell them I'm bipolar until I've already been hired.
Yeah, I was going to say that's probably the smarter move.
Yeah.
Yeah,
I wanted that for things to change. That's part of why I'm doing these alternative interviews, is because, when my first question is, tell me a little bit about yourself, I want to know something that's not on your resume. And I mean, I don't expect the people that I'm interviewing to out themselves, be like, oh, I'm bipolar, oh, I'm schizophrenic, oh, I'm bipolar, borderline personality disorder, oh, I have PTSD. Like, I don't expect people to say that. But if, like I said, like with the episode I just released, I specifically went into like, I'm bipolar, like, this is something that's like that, I want you to know this about me. It's really important that you know this.
Right.
So that you can understand why I do the things that I do.
Yeah.
So, yeah.
Do you find that they treat you differently, or because I know as soon as I started, I told my employer that I was in the hospital. And I feel like after that, they have been like, they're definitely like, they kind of walk on, eggshells a little bit, trying not to, I think they are afraid that they'll trigger something. So like, I work in a restaurant, so even when it's busy, they're a little more calm or a little more reluctant to, demand stuff because they feel like it might do something to me.
Yeah, so it all comes down to communication at the end of the day. I mean, with this employer, it's been great, but unfortunately, with the employer before that, it wasn't great. Like, I think I just needed. It's also how much you feel comfortable too, right? Like,
Yeah.
I told my employer before this one that I was bipolar, but I didn't really explain to them like, hey, there'll be some days where I'm an hour or 2 hours late to work because I slept through my alarm, or I didn't fall asleep till 3 a.m. and I had to take extra dose of quetiapine, which then means that normally I take my quetiapine at 8 p.m., which means it'll be out of my system, or most of it out of my system by the time I start work the next day at 8 a.m.
Right.
So I'm not as tired. But if I can't sleep for whatever reason because I'm having these racing thoughts and I'm going hypomanic and I take an extra 200 milligrams of quetiapine at, I try to sleep from, between 11 and 1, and I couldn't. So then I take the extra quetiapine at 1 a.m.
Right.
But then now the half-life is pushing over into midday that following day. So it's hard to get up and be productive and like you make it to work on time, or even do productive work once it is that time, or just like, because all I want to do when I get up at that time, all I want to do is just go back to sleep.
Right.
Because it's hard to function.
Right? Yeah. Yeah.
So, yeah.
Yeah, it's I think I want to ask, like, for the kids that are or just starting to realize that they have some issues, what's some like advice or like
journal,
anything you can share? Journal.
Yeah.
That's a big one. Yeah.
Because it doesn't have to be anything overly specific. You don't need to get into the nitty and gritty, but when you're first getting diagnosed or switching medications, you need evidence.
Yeah.
So it could just be quickly, I took this medication at this time. I went to bed at this time. I woke up at this time. When I woke up, I felt this.
Right.
For the remainder of the day, I felt this. And you can just make a mental note too. That's usually what I do. Like, I really love to journal when I'm manic, but I don't journal when I'm not manic. Because I don't know, I just feel like I don't know what to journal about. Whereas when I'm manic, I have all these cool thoughts that I want to get out on paper.
Yeah.
So.
Yeah, I used to journal a lot in high school, and now I'm just starting to get back into it, and it is very helpful. So, yeah. Is there anything else you want to?
I don't think so.
Go with it?
Did we cover all the things on our list?
I believe so. SSRI.
Yeah, so I guess we could touch a little bit more about the medications. So, like, we talked about mood stabilizers.
Yeah.
But sometimes for bipolar people as well, there are these things that are called SSRIs. I don't know what it stands for, but they're more categorically used to treat depression. So they can be used for bipolar type 2 more than they would be type 1. But you have to be very careful with antidepressants, really, for anybody. I mean, not just for bipolar type 2 people, but you get on the wrong antidepressant, it can actually, like, sure, it'll take you out of depression, but then it'll send you into mania instead. So it's you got to really work with your psychiatrist and be like, this is what works for you, this is what doesn't. And I have a buddy named Jason Wagner. He actually has a book out on how to deal with it. Oh, I should pull it out. Oh, shoot.
And it's all about this is just about
Manic Man by Jason Wagner and Dr. Kerry Burns. So, how to live successfully with a severe mental illness. So, he wrote this book a couple years ago. It just goes over, it's a memoir. It goes over his first manic episode, and he hasn't had a manic episode since to the date, because he talks about in the book about going through 23 medication changes. And that wasn't 23 different medications. That was like, okay, we'll try 1,000 milligrams of this. Okay, try that for a few weeks. Oh, that didn't work. Maybe we'll reduce you to 500 and add this other one called whatever.
Right.
So he said he went through over between 20 and 30 different changes. I was lucky that I found lithium. I mean, but that didn't work for Jason. I think he was probably on that as well.
Yeah. Interesting. Maybe I can borrow that book sometime.
There you go.